irritable bowel is very common. Maybe 10 to 20% of people in developed countries have irritable bowel, and a lot of times it's underdiagnosed. Maybe 3/4 of the patients are underdiagnosed, and only about 1/4 seek professional care. And this does affect twice as many women over men, and the diagnosis is between ages 25 to 54. So you have the whole gamut there. So there are challenges when you're taking care of IBS-D. This is the diarrhea predominant irritable bowel patients. They want to get help for their bloating and discomfort, as well as chronic loose and frequent stools. And sometimes these are disabling. These people can be housebound and they avoid social events. And the physician's understanding also can fluctuate a lot. It's a little unclear about the etiology. And let's face it, again, as I mentioned, the patients are uncomfortable speaking about this. There's a difference in treatment goals between patients and physicians. It's interesting, that's also true in inflammatory bowel disease also. The severity of symptoms are patient-reported and assessed for severity. There's a variation in the definitions of diarrhea, and there's a variations of definition and the practice definition of IBS-D. And right now, they really don't have great algorithms of care for patients who have irritable bowel diarrhea predominant. And sometimes with medical care, you're saying, well, you look for red flag symptoms. Well, it's actually the absence of red flag symptoms that you're looking for, which is, it's hard to look for something that's missing. And often, as it says on the last point, it's usually a diagnosis of exclusion